Welcome to Policy Talk. Hi, my name is Jimmy Sellers, and I'm joined today by Director of Policy for Good Business Colorado, Angelique Espinoza. We're going to be talking about the introduction of the Colorado option into the State House this coming week. If passed, this bill would give care providers and others several years to find a way to reduce costs for customers. Insurers would be asked, but not required to, introduce a Colorado health insurance option with certain targets for costs and benefits starting in 2023. Angelique, what do you think about this big bill?
Well, you're right. It is a big bill, not only in terms of it's longish, but also it's one of the biggest things I think that's happening in the legislature this year. There's certainly a lot of people on both sides of the issue that are going to be spending a lot of money, and so we're paying close attention to it as it moves forward. I would say the major components that are of interest to small business are being included in phase one of two phases. So that's really important, knowing that we're going to get some relief early in the process rather than having to wait. And that we are looking at premium reductions of up to 20% by the second year of the implementation. That's really the main thrust of the bill. And then there's a lot of details.
So this, if passed, this bill would be rolled out in two phases. Can you tell us about those phases?
What will happen is that the insurance commissioner and a group of stakeholders will define a standard plan to make sure that the plan is a good one. It has to include a silver, bronze, silver, and gold options. It has to include things like first dollar coverage for certain things. And then the state will not be offering this plan for the, in a big way for the first phase. What will happen is the insurance industry, the insurance carriers, will have those first 2 years to meet the criteria that were defined for the plan option at a cost in the first year of 10% below the premiums that they had in 2021, and by the second year at 20% below those 2021 premiums. And that is for both the individual and the small group markets. It's important to note that's a pretty small slice of the overall insurance industry. That's folks who are not getting insurance through their employer. So that's your individual who, either works for a small business, presently is getting their healthcare through the individual market, then their employer could have a better chance of being able to offer them coverage. Solopreneurs, certainly, a lot of them are looking at individual healthcare costs. So it's a pretty small part of the market that this impacts, but it matters a lot to small business people. And then, as you said, if they're not able to meet the criteria that are set out, then in the third year, the governor will convene a board, and that will be the board of an authority, the Colorado Option Authority. And the Colorado Option Authority will then offer that plan to meet the criteria at 20% below the 2021 premium costs.
Can you speak to the opposition stand on this bill?
I saw a great explainer that Kyle Clark, who's a news anchor, did, and it was on the old draft of the bill. So unfortunately, it's some of the pieces are out of date, but some of them are right on target. And one of them is that the ads that the opponents are showing are disingenuous and really some of the claims patently false. So one of them is that this is a public option, and that your health care will be through the government, and the government will have control of your health care. So none of those things are true. There will still be a market in which the insurance carriers can operate. People are choosing, can choose this option. So it's not government control of, and the insurance companies can choose not to offer this particular plan. So that piece of it is wrong. It's not a single payer kind of process. The other piece that we've seen the industry talk about, and by the way, those ads are paid for by the insurance industry and the hospital associations and so on. They've created a sort of an organization that doesn't have them in its name. And they're running sort of the money, so it's a little bit hard to track down, but you can track it down, and it is coming from industry. So they have a vested interest in saying things about the plan that aren't precisely on target.
Can you share with me why this bill is important for businesses?
Well, we've heard from our small group, our small business members, that they are really, really worried about health insurance. This is one of their biggest costs, for many of them, the biggest cost after payroll. And they really want to provide healthcare coverage as an employee benefit for a couple of reasons. One, simply because they want to be competitive with bigger organizations that can offer health insurance, bigger companies and corporations that have better benefit plans. They want to be able to keep their employees and not lose them to those bigger companies. But the other piece is, they're good businesses. They operate on the triple bottom line, and they believe that it's the right thing to do to provide that employee benefit. And many of them simply cannot afford it on the current market. So this will provide a 20% discount on what we're looking at in the market today. And for many of them, that's the difference. That's the difference between being able to squeeze it into that tight small business budget and not being able to do it at all.
Angelique, can you speak to, if any equitable safeguards in this bill?
Yes, I'd be happy to. So part of our coalition, it's a pretty broad coalition supporting the bill, and we've got a number of organizations that serve underrepresented and underserved communities, and their concerns are addressed in this bill. And part of that is that the plan, which I mentioned, has to provide a certain level of service, also must be designed to improve racial health equity. Through a variety of means, and one important one is including the improvement of perinatal healthcare coverage. As we know, there's a crisis in terms of maternal mortality in the African American community, and that runs across the economic spectrum. It's not just women who are living in poverty, it's women of all classes see these health disparities. And of course, as we know, with COVID-19, vaccination rates among those communities is embarrassingly low, shamefully low. And that's why it's so important that this specifically calls out racial health equity as a component that must be designed into the plan. And that design is done by stakeholders that do include healthcare industry representatives, but also consumer representatives, and then individuals who represent those underrepresented communities, whether it's by race, ethnicity, age, sexual orientation, and importantly, also by geography. We know how important it is that the rural areas of Colorado be brought along, because a lot of them face a lack of competition in their region and other things that drive up costs for the rural areas. In addition to that piece, there are other stakeholder groups or boards of directors. There's a board of directors for the authority that would be set up in phase two, should we get there. And there's also an advisory committee, and both of those call out giving attention to representation of diverse populations. So it's baked in to the bill itself.
Well, here's a big question. How is this bill going to be paid for?
That's a great question. And there's an interesting mechanism that's spelled out in the plan. It's a little bit complicated. I had to do some significant Googling to get it all figured out, but I'll give a shot at explaining it.
Thank you.
It's going to be paid for by something that's called either a waiver or a pass-through. Essentially, what happens is that when the American Care Act, which is the Federal Care Act, applies to all the states, and there's a waiver that a state can apply to. It's called a state innovation waiver for states to encourage them to figure out ways of making healthcare less expensive, which is precisely what this bill is designed to do. So what will happen is that we will demonstrate how much money we have saved the federal government in tax credits because of the savings in premiums. And then the federal government will take those savings and distribute them back to the state as a pass-through. And that is the funding that is dedicated then to funding the Colorado Authority, which would provide the Colorado option in phase two of the plan, should the insurance companies fail to meet those 20% reduction targets by the second year.
Before we close, Angelique, is there anything that you would like to add about this bill?
Well, it's going to face a tough go in the legislature, that's for sure. The industry, the insurance industry, the hospitals, which, by the way, have some of the highest profit margins in the nation, some of our hospital systems in Colorado, they're going to put a lot of money into opposing this bill. And so it's really important for small businesses, especially, who would like to see this pass, would like to access those lower rates, offer an employee benefit of health insurance, for them to tell their stories. We've already heard some really compelling stories from our members of their struggles with healthcare and with their desire to provide it. But it's always good for folks to be able to tell their legislators, hey, this is why it's important. It's not just about, the sausage making that is negotiating with industry on the bill. There's also this very real human component. And healthcare is something that people now more than ever really need to have in order to support them and their economic well-being, but also to support our economy. I mean, if we have so many people falling below poverty level, especially with unemployment, then they don't have access to insurance either. It's bad for us as a whole economy. So it's it's the individuals and it's us as a whole economy, and it's those personal stories. It's those real on the ground human stories that really move legislators when it counts.
Thank you for joining me and Angelique Espinoza of Good Business Colorado. We'll see you soon. Thank you for joining us.